Hey everyone. Awesome, thank you for the response. I so wish that I could be there with you in person, um, but I'm grateful to have a few minutes to provide a progress update live here from Nairobi. As I reflect, in 2009, I was there asking you all to imagine what it would be like to travel with your family 100 miles to reach the nearest hospital. And you were sort of hearing about and seeing what I was seeing and learning why medics started our work, because people were being systematically excluded from care. And I use those words very specifically, that system designed by human beings was excluding people from care. I also asked you all to empathize with a community health worker named Dixon. Dixon is in Malawi, and he looks after patients every day, walks 35 miles to provide updates to the local hospital to let them know how those patients were doing. And finally, I asked you all to help advance our mission, to change that status quo, to support Dixon, and to help Medic Mobile build software for those frontline health workers to improve health in the hardest to reach communities on the planet. So it's a great privilege to be able to duck into your gathering there and report back, honestly. And I had some fun with the numbers. So in 2009, we were a handful of volunteers, and fast forwarding to today, I'm surrounded by 56 brilliant full-time teammates in offices here in Nairobi, in Kathmandu, and San Francisco. At the time, in 2009, we were working in 2 countries in East Africa. And today, we're operational in 21 countries in East and West Africa and South Asia. And in 2009, we were supporting a little over 200 health workers. And today, by the end of this year, we'll be supporting a network of 14,000 health workers covering about 10 million people around the world. And magically, somehow, between 2009 and 2016, I managed to age about 40 years, as you might be able to tell. And I've learned some things along the way. I've learned that a big part of my job is to find and recruit people who are a lot smarter than me in specific ways. I've also learned that complexity shouldn't and can't stop us from trying to solve these problems. That human behavior and politics and power dynamics are complicated, but these problems will stay as they are and will stay wicked problems unless we do things about them. And having a community like PopTech really helps in that pursuit. I've also learned that we cannot shy away from discussions about ethics, that we either take a moral stance in this work or we are directed into one, and that questions about what is right and what is just are exactly the right questions for us to be asking ourselves and to be asking and talking about with our team. And finally, I've learned that we are freed to focus on a particular piece of the puzzle when we have amazing friends like you all in the room. We saw that in action working with Ken Banks, which made that early work possible, and really through a dozen or so collaborations with PopTechers, many of whom are in the room. And through that work and work with lots of other partners around the world, we have seen firsthand that healthcare systems can be reimagined and redesigned, that community health workers can be supported with a powerful mobile tool in their pockets, connected to a team, and supported as they provide equitable care for their neighbors around them. To give you a sense of what that looks like, one of our partners is in Uganda, an organization called Living Goods. And they support over 1,000 community health workers. And if I look just at the last 7 days, with support from our application, that network of 1,000 health workers provided treatments for 4,000 children, looked after 2,000 pregnancies, and visited 1,500 newborns for the first time. So there's proof, there's a lot of good happening in the world every single day. And honestly, those people and those paths from house to house are what give me hope for the future. And show me that there are very specific ways that technology can bring about shifts in systems as complex as global health. That we need to be shifting from thinking about cases and patients to serving people across time and place. That we need to shift from passive health systems that are in place for sick people to come to them, as opposed to proactive systems where we visit every family every month. And we need to shift from leaving health workers on their own as they do the best that they can, to making their work visible, making challenges visible, and making progress visible as we deliver equitable care in the mountains of Nepal and rural slum and urban slum communities in Uganda and Kenya. And I'm excited to report that in the next 12 months, we are on track to reach an additional 10,000 communities all over the world. And if I look just a few years after that, 2020, we are aiming to meet the goal that we set as PopTech Fellows in 2009 to improve healthcare for over 50 million people. I am very much looking forward to checking in again and reporting back on that. And I'm grateful for your time. I hope you enjoy Camden, enjoy each other, and I hope to see you all soon.